Jeff Slauson here from 19 News Now at the 19 News Digital Desk. This update came a little bit ago from the state, but wanted to make sure that you had the access to it here. Ohio's Department of Health is announcing a massive problem here. Increases in injuries as a result of e-cigarettes, particularly with those that are less than 5 years old. This is a massive problem. We had the press conference earlier today. We did not stream it yet. I want to bring it to you now. Again, this is Dr. Bruce Vanderhoff, the commissioner with the Department of Health. Bring it to you now.
Turn to a topic that may seem a bit like old news: the serious health threats posed by tobacco and nicotine. These include risks posed, though, by some new delivery methods and substances that continue to endanger us, including our youngest children, in new ways. Let's be clear. Nicotine, in whatever form it's delivered, is dangerous. It doesn't matter if that's by cigarette or a vape pen. Nicotine is harmful and can lead to addiction. Smoking or vaping has a chemical impact also to your lungs. The Ohio Department of Health has been working very hard over the years through numerous programs to bring down Ohio's smoking rate, and in more recent years, to combat a rise in youth vaping. When Governor Mike DeWine took office in 2019, he became a leader in this effort, working to pass legislation such as the Tobacco 21 law in October 2019 that made selling any type of tobacco or nicotine products to Ohioans under the age of 21 a criminal offense. Now, I'm pleased to see signs that these efforts really are working. Ohio's adult smoking rate has fallen from 25.5% in 2011 to 18% in 2021. In terms of our youth, the Ohio Department of Health saw some promising trends show up in the Ohio Youth Risk Behavior Study that the department conducts every other year to monitor the health risks and behaviors of youth in Ohio. The 2021 data is the most recent available, and it showed that vaping use dropped substantially between 2019 and 2021. The number of students who reported currently using a vape product fell among our middle schoolers from 11.9% to 9%. And for our high schoolers, those who were reporting current vape use, that statistic fell from 29.8% to 20%. Now, as promising as these statistics sound, there is still much work to be done. In fact, Ohio's adult smoking rate, while improving, remains above the national average. And over the past few years, Ohio and the nation are seeing a new rising danger. We all know that secondhand smoke can cause serious harm to others. But now I want to raise the alarm that the liquid in e-cigarettes or vaping devices are proving to be an increasing risk for our young children. This liquid can contain nicotine, THC, CBD, flavors, or some combination of those. Young children can be poisoned by swallowing the liquid, taking a puff if they've seen someone else use it, or even from absorbing it through their skin or eyes. The number of e-cigarette exposures reported to the Ohio Poison Centers has nearly tripled in the past 7 years, from 130 in 2015 to 360 in 2022. And data so far in this year, 2023, signals yet another likely increase, with 328 exposures just through September. And what is most concerning is that the majority of those exposures, more than 70%, have been reported among children ages 5 years of age and younger. The raw numbers since 2015 through the first half of 2023 are 1,762 exposures, and 1,301 of those have been in children 5 and under. Now, to talk more about this danger, I'd like to welcome our guest, Dr. Hannah Hayes, Medical Director, Central Ohio Poison Center, and Chief of Toxicology, Nationwide Children's Hospital. Welcome, Dr. Hayes.
Good morning. Thanks for having me.
Happy to have you. Dr. Hayes, you've heard me talk about increased e-cigarette exposures, but can you tell us what those exposures can actually do to a child, and what sorts of effects or injuries can you see as a result?
Mm-hmm. So the majority, 2/3 of the exposures that we see to liquid nicotine is ingestion. And 1 in 3 of those children develop symptoms. Nicotine's very irritating to the stomach. And so by far, the most common symptom we see is vomiting. Some other things that we commonly see are fast heart rates. We see jitteriness and agitation, sometimes diarrhea, and not surprisingly, irritation of the mouth. There have been severe cases, unfortunately. Larger ingestions can make kids very, very ill. One child had a large ingestion of 10 milliliters and developed loss of consciousness, muscle jerking, repeated vomiting, and had to be placed on a ventilator or breathing machine.
Well, I mean, clearly, these are effects that we do not want our children to experience. Dr. Hayes, what sort of preventative steps would you recommend that the adults in these children's lives take to keep their children from accidentally hurting themselves in these ways with these devices?
The number one prevention strategy that poison centers recommend is to store liquid nicotine and, frankly, all medications and drugs up and away and out of sight of children, preferably in a locked cabinet or box. One thing that I counsel parents on when I see them in the hospital with their children for this is to not store them in a purse. Storing in a purse is a place that a lot of people put these things, but children can easily access the products there. And we don't even want children to handle these products because dermal or skin exposures can cause symptoms. In one study, 1 in 4 children who handled a device got symptoms like vomiting or eye irritation from touching their eyes. And all of the children in that study were handling functioning devices that worked. So it's not clear if there was nicotine on the outside or if they were intermittently leaking. But parents should know that children can get sick just from touching a device, even from touching a device that is intact.
Yeah, and the numbers are not great associated to this. That is something that we'll be breaking down tonight on 19 News at 10 and 11. Of course, 7:30 will be our 19 News at 7:30 over on the CW, so we'll see you there. We have a busy night here as well on 19 News, so we'll have an update from President Biden at 8 o'clock. All right, that's it for this digital stream. Much more to come both on air and online. For now, I'm Jeff Slauson with 19 News. We'll see you coming up 7:30.